Hello students, we will discuss a very interesting condition which often you will come across, even though not that common. What this condition is, see that in the thumb there is a very dry, warty, proliferative region. Not exactly fungation, but fungation like, but fungation will be wet. It is not wet, it is dry. Exophytic, dry, warty. Unlike fungation, it is wet actually, it's not wet. So, verrucous carcinoma thumb nail bud, carcinoma cuniculatum. Usually, this word is commonly used for the similar carcinoma, commercial carcinoma type, occurs in the sole of the foot. But occasionally, it can occur in the palm. Then it is also called as carcinoma cuniculatum in the hand. Commonly, even though it is used in the foot, it can occur in the hand. So, what are the features? Very indolent, slow growing, warty, exophytic surface. Usually basement membrane is not involved. Lymphatic and blood spread are rare. Happens only when it becomes invasive, when it spreads. Of course, it becomes invasive commercial carcinoma. Biopsy confirms the diagnosis. Human papilloma virus may be the cause. Treatment is wide local excision or digital amputation depending on the location. Often local chemotherapeutic applications are useful. So this is verrucous carcinoma, exophytic, dry is most important, exophytic, dry, proliferative lesion. So carcinoma cuniculatum, this word is commonly used when it happens in the foot, but it can be used here also. So that is about verrucous carcinoma. Verrucous carcinoma can occur in the oral cavity, mucocutaneous junction, perianal region also, other areas. So we have to remember that verrucous carcinoma is a common short note task. Really, we don't give radiotherapy. Wide local excision is sufficient. Send it for biopsy. Lymph node dissection is not necessary because it is not involved. It is more often it is curable type. That's the point you have to remember. So go through my clinical surgery, manual of surgery, operative surgery, and extensive video lectures of DigiNerve covers everything, UG and PG, including specialties, operative procedure, X-ray, instrument specimens. So students, I hope you have understood this verrucous carcinoma very well. Thank you very much.